Welcome to Joy in Our Town. I'm your host today, Kate McGovern, and today we're going to be talking about mobility. And with us today is Dr. Jerry Krukenberg. Jerry is a chiropractor here in our local area. Jerry, welcome to the show.
Thanks for having me, Kate.
Jerry, tell me a little bit about how the mobility concerns have caused you to go into chiropractic care.
Well, what I see, Kate, is a lot of people, especially young people, are not being able to move around as well as they usually do. I see a lot of people, especially like in Walmart, using those motorized vehicles and that. I see them hardly being able to get in and out of cars easily, walking. I've seen people that are very, very large in their frame and not being able to move around very well, and they're a lot younger than I am.
You know, there is a lack of mobility for our seniors, and that's why we see a lot of them in nursing homes today. Can you talk to us a little bit about that, Jerry?
Yes. Lack of mobility ends up having to cause a lot of different problems. It makes people overweight. When you're overweight, you tend to have diabetes, high blood pressure, stroke, and those are a lot of things that lead people to go into nursing homes or complications from those different diseases.
Well, how widespread are these mobility issues?
I think they're becoming a lot more widespread than when you and I were kids. We've got a lot of automated things nowadays, remote controls to our TVs. A lot of young people, especially, they'll just drive up to somebody's house and honk the horn just to have people come on out rather than going up and knocking on the door. You know, we've become a little bit dependent upon those type of things.
What are some of the trends that you see with mobility issues in our local area?
I see that they tend to be getting a lot worse. Again, a lot of people are severely overweight. That puts the stresses on the knees and hips. So if there's a lot of stress on those joints, it makes them a lot more harder to work.
What terms do patients use with you and telling you that, I just can't do that anymore?
Well, exactly that. They're called activities of daily living. And Kate, those are the basic things that we can't do. Go up a flight of stairs, wring out a washcloth with our hands and such, just brushing our teeth or combing our hair, just normal, common, everyday things that people just take for granted at times.
What are just some of the typical causes that we have for decreased mobility?
Typical problems are sedentary lifestyle. You know, the old saying of, oh, if we don't use it, we'll lose it. God gave us over 200 bones in our body, over 600 muscles in our body. Our bodies were made to move. That's part. Another part is if you smoke, that's a toxin going into your system. That affects the small blood vessels in your body, which lead to the various organs. Alcohol also, toxin, and that kind of thing.
What is the impact of obesity having on our mobility and just even in our future in living?
It will definitely cut down how long we're going to live. Okay. When we are overweight, we have a greater chance of having the diseases I mentioned before, the high blood pressure, the stroke, the heart attacks, the diabetes. Those diseases are bad enough in themselves, but there's also complicating factors. Like with diabetes, you can be blind. You can go ahead and have amputations. Heart attacks, you can go ahead and, of course, decrease mobility even further.
What other behaviors factor in on the decreased ability for our mobility?
If you don't have a good social network, if you don't get out with other people, that is not very, very good. If you are dependent upon a caregiver right now, if you depend upon them too much, that if you don't do what you can right now, that's going to decrease your mobility.
A lot of people believe that it's just a natural part of living, losing our mobility. What would you have to say about that?
I'd say that's true to a very, very small extent. Just recently I've seen on Facebook this one gal, she's a bodybuilder. She's in her 80s. She looks fantastic. So if an 80-year-old can have good mobility and good muscle tone and that kind of thing, we can also. We mainly have to just make sure we keep an active lifestyle in that.
As a chiropractor, what are some of the problems that you see that are changing over these last few years?
I think getting back to, relying too much on automated things, keep active, go up and down the stairs and that. So I see people just becoming more and more inactive.
Tell me about how our social life influences our mobility.
If we're going to stay home, that's obviously decreasing our mobility. If we go out and interact with people, get involved with different things, different charities even, and just you're out and about, you're more likely to just keep your mobility, keep moving in that. If you sit down and watch TV, you're just going to keep doing that.
As a professional, what are some of the things that you share with your patients about becoming mobile?
I share with them that basically go ahead and start where you're at. If all you can do is just go up a couple steps a day, come back down, that's fine. Or if you can just go to the mailbox to get your mail and then come back, that's fine. Make it a goal of like 1 or 2 weeks I'm going to do this. At the third week, I'm going to take a few more steps and just go ahead and challenge yourself.
Sure. What are some of the consequences, Dr. Krukenberg, of decreased mobility?
The decreased mobility will lead to, of course, weight gain, and that with the weight gain, we'll develop a greater chance of all those diseases again that I mentioned and the complications of those.
Let's talk about some solutions. What are some of the things that you would really encourage your patients to do to really become mobile and to really help themselves in retaining their mobility?
First and foremost, start moving. Start where you're at. If you're in a wheelchair, if you can, all you can do is just lift your legs up a few times every day, go ahead and do that, because eventually you're going to start to be able to do more and more. If all you can do is just lift up your arms and bicep curls, go ahead and do that. Just start where you're at. Again, make it a goal of I'm going to do this like 3 times a week, I'm going to do it 5 times a week, whatever your goal is, and then after that, say I'm going to increase it. I'm going to add a 1 pound hand weight or something like that. Give proper nutrition to your body. Your body needs nutrition in order to live and proper functions and that kind of thing. So that's what I would recommend.
I'm sure that you have seen so many incredible success stories. Could you share a few of those with us?
Oh, sure. It happens on a daily basis. Somebody will come in, most common problem is low back pain. They come in doubled over, can hardly walk, get them adjusted. They may not be walking totally straight when they first get adjustment only one time, but they are decreased in the pain and can stand up a little bit easier. It's a miracle. I love it.
Tell me a little bit about, does a sedentary lifestyle, and now you're middle-aged and you've lived this sedentary lifestyle, how does that affect your future? Is there still hope?
Oh, yes, of course. There is always hope. The main thing is see what you can do, see what you like to do. I love going to Zumba classes. I love weight training, bicycling, that. Do what you like to do, because you're not going to have to talk yourself into it. And there's no sense in arguing with yourself about doing something that's good for yourself. So start where you're at. It's never too late.
Well, here's a great question for you, Doctor. Tell me, what would be the best thing for our children to keep them mobile and to prevent them from, their mobility being retained as they grow older?
First and foremost, I would say be the parent. Get them out, get them away from this constantly. That's okay for a little bit. Be active with your kids, because that's going to help you and your children. And, lead by example. Lead by example is the best thing.
Talk about how some of these conditions can be treated by chiropractic care.
Oh, as far as the immobility, we get the spine adjusted. Everything in the body is controlled by the nervous system. So we get people adjusted. The nervous system can control the limbs, the ligaments, tendons, muscles, organs to their optimum function. So that overall helps.
How can someone and our viewers find out more about staying mobile?
Google is a wonderful thing. You can just type in anything and you get a bunch of different sites. Just type in decreased mobility. You'll end up with a lot of different websites to go ahead and just check things out and see.
Could you please recap a few things that would just be really helpful to our viewers today?
Okay. I would say the main thing is start where you're at. Again, You know, if you're not mobile, you can't go ahead and commit to exercising like 6 days a week for an hour. Start where you're at, and then gradually you'll get better and better and be more mobile. Give yourself some good nutrition, good whole foods, stay away from the fast foods, drink plenty of water, adequate rest.
Thank you so much today for joining us today on Join Our Town. And just want to say thank you. See you next time.
This program has been sponsored by the Trinity Broadcasting Network and made possible by your telethon dollars. Your continual support can keep Join Our Town brought to your home every day. So write Join Our Town, P.O. Box A, Santa Ana, California, 92711.